Sorry for the long delay. Figured it was time for a update video real quick. Got a bunch of comments here that I need to answer. Hopefully my dog will remain calm during this. He just got neutered yesterday and he's got the cone of shame on. Poor little guy. Also had to have a umbilical hernia fixed too, so it's a combo of crap. So he's in the same boat as all of us, having to go under the knife. Anyway, so let me just give you a brief update. It's 10 weeks post surgery, I think, at this point, and things are going pretty good. I noticed that, I've just been working a lot lately, and I still get tingling in my right arm sometimes because that's the one where the nerve pops out of where it should have been transposed to when I fully extend my arm, and just, due to that, it gets a little bit more irritable. But the left one, it was up and down for a while there, and, knock on wood, it's been pretty good. It hasn't really bothered me too much after typing a lot or playing guitar. If I sleep on it weird, it can. So I've been trying to be more conscious about that, and things have been better. I started working out again, probably for the past, I waited 2 months, so it's only been 2 weeks, I guess. But actually, I've probably been, maybe it was 7 weeks. It was kind of like 7.5, I think. So I've had, I think, 2 weeks of workouts now, and I was just doing a light upper body thing. And, it's going good, getting range of motion back. Still kind of hard to fully extend and, strength, flex my tricep or something when that happens. But overall, pretty good. I'm actually feeling pretty encouraged from the recent surgery and from how my left one's doing in comparison with the right. I was telling my wife last night, I hope everything, stays kind of the same as it is, and I wind up with at least like one really good result. I mean, my right is much better than before I had the surgery, but the left is really good at this point. Really good. I could not ask for anything better. So for all you guys, that was one of the things I wanted to share because I got a lot of questions here. Like, for example, this one person was asking, where was it? Somebody was asking me, I can't see it right now, but they lifted their friend off the couch and their arm was tingling and as their symptoms returning again. Just try to be patient, don't freak out too much because those types of things can, happen a little bit. What in the world? Sorry. I'm sitting in my office and I'm facing the street and there's a white pickup just slowly creeping through my neighborhood. I don't know if it's like the HOA trying to take pictures of everything or what they're doing, but never a good sign. Sorry. So yeah, don't get too freaked out if things start to bother you. This person was asking me here, Alyssa Lewis, after surgery, were you in a hinged brace? No brace at all, just a wrap, soft wrap. So they put gauze on the incision, wrapped it in this like sort of padded wrap, and then wrapped it with your normal sort of gauze. So in a sense, it's kind of hard to straighten your arm out completely because it's all wrapped up, but it's definitely not a stiff thing or anything. And I know some doctors do that, but I don't see the point in that because I can tell you right now, with my right, I really worked on using that right away, and I definitely have really good mobility. I mean, honestly, there's literally no stiffness. My range of motion is totally the same. With the left, I babied it a little more, and it's a little bit more stiff, and the range of motion is still coming around. So it's like the quicker you get into sort of the rehabilitation types of things that they told you to do, even if it's just kind of doing this, the better. I mean, don't force things, but you definitely want to kind of use it for light stuff like that. It'll help it recover a lot faster, without question. So yeah, no brace. At least I didn't have one. Some doctors do. So this person's saying head. Oh yeah, there was the pick a person up off the couch thing. Yeah, don't freak out if you have symptoms for like one day. If they persist for like a month or something, then maybe you got to start trying to look at things and see what's going on. But if you have a couple days, you might have just slept on it weird, you might have just irritated it, it'll go away. Just remember when you have your nerve transposed, this is when your nerve is at rest, when your arm's bent, right? Because having it straight here, it's either stretching it across the sling or, stretching it across something. So this is the natural position after you have the transposition. That's something to keep in mind because when you want to rest your arm, before you had your surgery, we taught keep your arm straight. You're stretching your nerve when you do this. But after they move it over that medial epicondyle bone, this is now where it's kind of relaxed. So whenever mine are irritated, I try to keep my arms bent. Um, let's see. Are you sure it's not coming from your back or a thoracic nerve pecs? I think mine is my neck, but presenting in my elbow and wrist. Michelle Snodgrass. It's possible that stuff happens. I had a coworker that I used to work with where his was a result of a pinched nerve, and he kind of had the same symptoms as me. So you have to get these things checked out. But it was really clear that I had subluxation in both arms. I've showed you guys a couple stretches on some previous videos that you can do that'll show you if you have that. And for the people that have it, it's pretty apparent sometimes. Like if you're exercising or you're doing certain things and you have your arms bent for a while and you get pain in your elbow and numbness, it's pretty clear it's coming from your elbow, especially if you get pain at your elbow. My boss just had tingling in his fingers. That if you just have tingling in your fingers, that could be from something in your neck or going through your chest. My wife also had a coworker that had thoracic outlet syndrome, which is much less common than cubital tunnel types of things. So subluxation, cubital tunnel, much more common than thoracic outlet syndrome or having a pinched nerve in your neck. That's not that uncommon, but again, you're not going to have pain in your elbow if you have a pinched nerve in your neck. Just you got to explore those things though. I went to chiropractors, I went to everything else before I figured out what I had. So I would recommend that if you have kind of symptoms that I describe in my videos to start with a hand surgeon. That's probably your best place to start, and then they can figure out what's going on and help you see somebody else if that's not the right thing. Let's see here. I'll do one more question before I got to get going. Courtney Riches, glad to see you doing so well. I had a pretty bad farming accident 2.5 years ago. Boy, when a story starts out with bad farming accident, you know it ain't good. Ultimately messing up my arm. I had medial epicondylectomy done almost 2 years ago, only relieving some of my pain. Last year I had submuscular ulnar nerve transposition done. Unfortunately, it didn't seem to help much. I'm in a great deal of pain, not to mention I have bad motor function, muscle loss. I'm still in high school. Oh, that sucks. And not quite ready to give up on trying to get better. My doctor wants to give it more time, but then I see people living functional lives after a surgery like this, and I feel left in the dust. Personally, I don't think he knows why I'm having problems. Any tips or experiences that you had that could help me out? Wow, that's a lot to unpack. Well, yeah, I wish, from what I had read before I had my transposition done, medial epicondylectomies, for anyone that's looking at that or getting recommended that, don't go down that road. All I've never heard positive things about that, and I've been told from pretty much, that was the only consensus I could get across every surgeon. None of them liked that, except one, and he was the outlier, and I just knew right then and there, and he didn't even want to kind of discuss the other options. So it more or less boils down to what these surgeons are comfortable doing, and if somebody's doing a medial epicondylectomy, that's kind of old school. They don't usually do that now. Subcutaneous transposition seems to be the most common. Boy, that you've had a submuscular, that's a lot of recovery time. This time last year, so it's been a year since you've had the submuscular done. I didn't go through that, so I can't really speak to it too much, but I do know that the recovery time is a lot longer. And yeah, I'm sure you have muscle loss because they have to detach that one muscle to put the nerve underneath it. So I would still try to, do any kind of rehabilitation stuff you can. It's probably important that you do or talk to your doctor or physical therapist about like nerve gliding exercises, because the thing that I hear a lot with people that have submuscular, sometimes it can get compressed underneath the muscle there. So you want to make sure that the nerve's moving freely underneath that muscle. I'm not knowledgeable on that because, like I said, I didn't really have that procedure done. But I would ask your physical therapist about that, or ask the doctor to give you some physical therapy prescription to address these things that you're having. I can identify with feeling like you're getting left in the dust, but just put things in perspective. Um, you see these kids with cancer and everything else, and having surgeries, and it makes our stuff look silly. To I know it gets annoying, but we're alive, and if this is the worst thing you have to deal with, then it's not that bad. So try to keep a positive attitude, because that does go a long way. Um, is there anything else I could tell you? I don't know if much more time is going to do it, but like I said, you got to try to do things to um, optimize it. If you're having issues, just doing nothing or doing the same thing is probably not going to make a difference. So, you know, uh, do some physical therapy, nerve gliding exercises. Just try a bunch of different things, because that's the only way you're going to figure out what works for you, or what helps it get better, or what irritates it. And that way you can start avoiding those things. So, yeah, Courtney, sorry I don't have anything better than that, but see another doctor too. That's probably the best advice I can give you. See another hand surgeon if possible, and that way you can get another opinion. But you also got to take inventory of what's going on in your own body. So when you feel things that are irritating it, write that down, and that can help them sort of figure out what's going on. So anyway, guys, hope all is going well. If you have more questions, let me know, and I look forward to answering them in the future. Okay, aloha.